course, the one we just conquered already, because all of the pieces fit together. You know, we talked about blood, we talked about the heart, we talked about vessels, and then we talked about how all those pieces work together. The rest of the chapters, you don't have at least not as much of that, where everything interacts or everything relates to each other. So in Unit 2, we're going to talk about the lymphatic system and the immune system, which is this chapter. Then we're going to talk about the respiratory system, the digestive system, and then what we call metabolism and energetics, or how the nutrients that the digestive tract brings in are used then by the body. So even though this Unit 2 is the longest in terms of number of chapters you're responsible for, the material, I think, is not as complex. Although there are pieces that are, like the immune system piece of this chapter is a little complicated, but it's a little bit of a change in direction. That first unit fits very well together, and then these other units are sort of separate pieces, all handled, one after another. All right. So first up is so this chapter is about the lymphatic system and immunity. And even though those two things are really very different, they're usually handled together like this because the principal cells of the immune system, which are the lymphocytes, they spend a lot of time in the lymphatic vessels. So we talk about those two things together. So as we go through here today, we're going to first talk about the lymphatic vessels, what they are. Then we're going to talk about the lymphoid cells, the lymphoid tissues, and then the lymphoid organs. And then I think probably next time we'll start in on the immune system part. So, here's sort of the overview. Lymph is the clear solution that's found in the lymphatic vessels. We'll talk more about that in a minute. All these green lines here are the lymphatic vessels. We all learn, in high school and middle school and all that about the cardiovascular system, at least a little. So we know that we have arteries, capillaries, and veins. Well, this is the system that very few people learn about outside of anatomy and physiology. The lymphatic system is, in fact, a separate system of vessels that helps to return fluid back to the heart. And it all comes from, remember when we talked about capillary exchange in the last unit? So we have an artery. So an artery here, a vein here, and a capillary, right? And we talked about how there's two opposing forces, right? There's capillary hydrostatic pressures pushing out, and blood colloid osmotic pressure is pulling in, right? So this is blood pressure, capillary hydrostatic pressure. So the artery has pressure in it, which means the capillary has pressure in it. That pressure is pushing fluid out, right? And then this colloid osmotic pressure is pulling fluid back into the vessels because there's so much stuff dissolved in the blood. This should sound a little familiar because we talked about it. But in that diagram, what we saw is that in the end, there was about, I think they said 3.6. There was about 3.6 liters that left the vascular system that never got brought back in before going back to the veins. Well, it's this system that's going to take this excess interstitial fluid, because remember, if we leave the vascular system, we're going to have cells out here, and between the cells is the space we call the interstitial space with the interstitial fluid. So interstitial fluid, just so you know what we're talking about, is outside the blood and outside cells, right? So that's the interstitial fluid, also sometimes called the extracellular fluid. So why is that important? Because if the lymphatic system drains excess interstitial fluid back into the cardiovascular system so that it can circulate again. And we'll see how that works here in a minute when we talk about the lymphatic capillaries. All right. And then we're going to talk about the lymphoid tissues and the lymphoid organs. Okay, onward. All right, first up, capillaries. So here we're looking at a capillary bed, and we've added the last piece, which is the lymphatic capillaries, or the beginning of the lymphatic vessels. So up here, we have an arteriole. So here's our arteriole, here's our venial, here's our capillary bed, right? Here's that precapillary sphincter that we talked about, regulating blood flow through the system. So the arrows are showing you that fluid is leaving the cardiovascular system all the time, right? So it exits the cardiovascular system and enters this interstitial space in sort of purple here. Well, if that were to go on and on and on and on and on, the tissues of the body would end up with more and more fluid around them. So essentially the body would swell up, right? The number of cells wouldn't change, but the amount of fluid around them would. So the size would get bigger and bigger and bigger. So enter the lymphatic capillaries, which are here in green. So the lymphatic capillaries capture this excess fluid. So the little black arrows here are fluid moving around. So some of the fluid goes back into the venules, but a lot of the excess fluid ends up in these these lymphatic capillaries. Now, one of the big differences here is these capillaries are not really tubes because they don't connect to anything, right? They have one connection on the outbound side, but they don't have an inbound connection. So they're sort of, we call them blind sacs. They're like cul-de-sacs in a neighborhood. You can only go one way. You can only go out, so to speak. So once interstitial fluid enters these lymphatic vessels, then we call it lymph. L-Y-M-P-H. Lymph is a little bit like plasma. Plasma is the non-cellular part of blood. It's like plasma without all the proteins. So lymph has much, much less protein load than plasma does. But it still has the things you commonly find in the blood, like sodium, potassium, chloride, things like that. So it's clear, it's watery, and as lymph passes through the lymphatic vessels, it ends up with all kinds of stuff in it. You get bacteria in there, debris from damaged cells or infection. Lymphocytes, which are the cells of the immune system, you find them in the lymph. So once fluid enters this vascular system, it becomes lymph. So how does it get in there? Well, the capillary evolved to be very selective about what goes in and comes out of it, right? We saw that the capillary, the cells come very close together, right? And for the most part, the only way to get from inside the capillary to outside is to pass through the wall of the capillary. Well, the lymphatic capillaries evolved sort of just the opposite. It's very easy to get into the lymphatic vessels. Very easy to get in, very difficult to get out. And the way that came about, or the reason that happens, is the walls of these lymphatic vessels, the cells that make the walls, overlap like shingles on a roof. All right, so, and you can sort of see that, this is probably the best one right here. Do you see how this cell sort of overlaps this next one? Well, what that means is we can have a kind of trap door effect. If this is our capillary, our lymphatic vessel, and we push on this cell right here, it'll push in, right? So that would allow a large thing to enter between these cells. Now, once we're inside, though, if we push back and we try to open that door again, we can't because it's blocked by the cell above it. So in some ways, the lymphatic capillaries are designed like a trap. It's easy to get in, but it's hard to get out. So, and it's evolved like that on purpose because once substances are in the lymphatic vessels, the body is going to clean that lymph before it puts it back into the circulation. So we don't want bacteria, for example, to be able to use this system to travel around the body, right? Because this system, unlike the cardiovascular system, this is a low flow system. So the fluid in these vessels moves very slowly back to the heart. It would be a perfect, interstate system for infection to move from one part of the body to another because there's very little motion in it. So how did the body deal with that? Trapdoor effect. So that once it's in, it's very difficult to get back out. All right. So we see the fluid entering here. You also can get lymphocytes can enter here, debris, all kinds of stuff. All right. So one of the common questions you get is, well, how are these capillaries different than blood capillaries are? And there are a number of differences. One is how loosely the endothelial cells that make them up are connected together. So you can see that, here's another overlapping spot. Here's sort of the gap, So unlike the very tight arrangement of the blood capillaries, the lymphatic capillaries are much looser to allow stuff to go through. They are a little larger, the lymphatic capillaries are, than a normal capillary. Their walls are thinner as well. One of the features of the lymphatic system is throughout the whole system, from capillaries all the way up to the big lymphatic vessels in the chest, the walls of lymphatic vessels are exceedingly thin and fragile. So, like in the cadaver, for example, you can't even find these because the walls are so thin that they're impossible to identify. So you have to think of the lymphatic vessels. They're there, you just can't see them. Even surgically or things like that. So they're very, very thin walled. All right. So what happens? All right. So these blind sacs called lymphatic capillaries, they empty into larger lymphatic vessels, and these lymphatic vessels, they travel along with arteries and veins. So just like when you find an artery, there's usually a vein next to it. Well, there's also a lymphatic vessel there too, you just can't see it. And just like medium-sized veins, like we talked about in our vessel chapter, the lymphatic vessels have valves in them. So see, here's a valve, here's a valve, here's a valve. They work exactly like the venous valves do. And that is, they allow lymph to flow in only one direction. So if the lymph is flowing this way, the valve is pushed open. But if the lymph tries to flow backwards, that valve is pushed closed. And, the lymphatic vessels, they don't have a pump. The cardiovascular system has the heart making pressure to push blood around all the time. The lymphatic vessel has no pump. So the way that lymph moves back up to the heart is through that skeletal muscle pump action that we talked about in the last unit. Where when muscle contracts around a vein, it pushes blood towards the heart. Same with the lymphatic vessels. And it's more effective in the lymphatic vessels as well because their walls are so thin and floppy. So every time as you move around, you're helping to push that lymph back to the heart because these valves allow lymph to flow in only one direction. So we get that pumping mechanism. So here again, after a long airplane flight, you might notice that your shoes are tight. And the reason for that is since you haven't been walking around and using your skeletal muscle, the interstitial fluid in your lower extremities has built up over time because there's no pump to bring that interstitial fluid back. So, by the time you get to your baggage, you've walked a little and maybe that's a little better. And it's because as you move, the lymph is pushed back up to the heart and helps to reduce that excess interstitial fluid. All right. So typically, artery, vein, and lymphatic vessel are all found together. Okay. So where does it all end up? Well, it's a complex system. If you look at this diagram, all these green lines are lymphatic vessels. So the system is complex. And unlike the cardiovascular system where we go sort of in not a straight line, but The lymphatics have a more diverse network. You know, it looks more like suburban side streets than it does an interstate system, you know, like the cardiovascular system does. But eventually, all of these vessels arrive at one of two places. And that is here, so right here. This is, in green, are the lymphatic trunks. So the right subclavian trunk, which is right here, it eventually empties into the right subclavian vein, which is here. So we have a non-symmetric distribution. Through the right lymphatic duct, again, which is right here, that's going to drain lymph from this area in our diagram. So the right arm, the upper right chest and back, and the right side of the head. So 1/4 of the body, the lymph returns to the circulation here through that right lymphatic duct. The rest of the body, so the other 3/4, comes in here through the left side, and that we call it the thoracic duct. So it's sort of an unusual spot in the body where we have a significant non-symmetric. You know, we have 1/4 going into the right side and 3/4 going in through the thoracic duct, which is right here. All right. So the lymphatic vessels. So the point of this system is to drain excess interstitial fluid and get it back into the circulation. Now, in that process, we also want to make sure that the lymph gets filtered because, like I said, it's easy to get into that. So otherwise, we would be putting all kinds of, potentially infectious stuff into our bloodstream. Yeah.
So does the lymph drain to the lymphatic duct or to the subclavian vein? Which one?
On the right side,
yes.
The right lymphatic duct empties into the subclavian vein, which is right here. And then on the left side, the thoracic duct empties into the subclavian vein on the left.
So they both go into the subclavian.
Yeah, but one's left, one's right.
Got it.
Got it? All right. Okay. All right, so one of the things we find in lymph, and some of the cells that we find in the other lymphoid tissues and organs are these guys, are the lymphocytes. So just by way of introduction, because we're going to talk much more about lymphocytes when we talk about immunity, but there's 3 basic classes: T cells, B cells, and NK cells. T is for thymus. So T cells spend some time in the thymus gland, which we'll talk more about here in just a minute. B cells, B stands for bone marrow. B cells are made by the bone marrow, and they don't spend any time in the thymus. And then NK stands for natural killer, in which sounds like a strange term to call a cell, but the NK cells are essentially they're immune cells that can fight off infection without any kind of training. So because they don't have to be trained, we call them natural killers, because they are sort of born knowing how to fight off infection. All right, so that's the 3 classes. Inside of the T cell class, we have multiple subtypes. So we have the cytotoxic T cells. Cyto is cell, toxic is damaging or deadly. So these are cells that are damaging to other cells. Cytotoxic T cells fight cell-to-cell combat. And we're going to talk about how that works next time or the time after. All right, so particularly active against mutated cells like you find in cancer or viral infected cells. So we'll see what they do later on. So that's one group. The helper T cells, they're called helper cells because they help the immune system do a better job. So they're assisting. And then the suppressor T cells do just kind of what their name implies, and that is they suppress. So what do they suppress? The immune response. So suppressor T cells help to control how active the immune system is. All right, so 3 types of T cells. B cells, when they grow up and start doing their job, they become plasma cells. So B cells and T cells look very much the same, but B cells once they're activated, they change. So we go from a cell that looks like this to one that looks like this. And plasma cells are antibody factories. So they essentially churn out antibodies to specific pathogens in the environment so that the immune system can fight those things off better. All right, so T cells with their 3 types, B cells become plasma cells eventually, and then NK cells are natural killers. All right, so much more on that when we get going later on. So a little history. So all 5 of those, so we got 5 types of lymphocytes, right? Cytotoxic T, helper T, suppressor T, plasma cells, which used to be B cells, and NK cells. All 5 of those are made in the bone marrow. So right alongside, red blood cells and the other white blood cells, right? So, so what differentiates them? Well, they all start there, and then the T cells eventually move to the thymus gland, and it's in the thymus where they sort of become professional T cells, so to speak. So that's how they get their name. And then from the thymus, then they're released into the circulation. The lymphocytes that we find in the blood, they don't live there. That they're just on their way somewhere. So just like the other white blood cells like we talked about, even though we detect these cells in the blood, that isn't where they belong. They're just on their way to living in the tissues, because it's out in the tissues that these lymphocytes actually do their job. All right, so from bone marrow to thymus for T cells. For B cells, they don't go to the thymus. Instead, they just make their way out to the peripheral tissues, and eventually they'll start producing antibodies. And then from the bone marrow, the NK cells do the same thing. Now, NK cells are wanderers. So B cells and T cells, they can end up in one place their whole life. The NK cells are always on the move. So the analogy here is it's immunologic surveillance. So just like the police, are always on the move, right, going through neighborhoods, they're constantly in motion, keeping an eye out for any trouble. Well, that's what the NK cells do in the body. They cruise around the tissues of the body looking for problems, looking for infection, looking for mutation, looking for signs of virus or injury. So the NK cells are like, patrol policemen on the lookout. And then when they identify something, they can trigger an immune response, and they can also deal with a lot of things all by themselves. So one of the new things that people have discovered is NK cells, or the absence of them, actually, plays a major role in cancer. So our cells, can mutate at any time, because there's all kinds of stressors on them. In people who don't have NK cells, their risk of cancer is much, much higher. Probably because NK cells are cancer suppressors. By cruising around the body looking for mutation all the time, mutation can be identified at a stage when it doesn't go on to become a tumor. So, and you'll hear me talk more about cancer and the immune system as we go on here. It's a hot research topic of, can we use the immune system to prevent or fight off cancer? All right, so just a little introduction to the lymphocytes. We're going to get to know the T cells, the B cells, and the NK cells much better when we start talking about immunity. All right. So where do these lymphocytes live? Where do we find them? We find them in 2 classes of places: lymphoid tissues and lymphoid organs. So what's the difference? Some organs of the body have regions where there is a cluster of lymphocytes, of immune system cells. And we call those regions of immune system cells lymphoid tissues. So for example, if we look at our picture here, what we're looking at is the digestive tract. So the lining of the tube where absorption occurs. So this is all digestive tract. But then nestled down here underneath this normal tissue is this big cluster of lymphoid cells. So we would call this a lymphoid tissue. So why is it there? To help fight off infection. potentially there's pathogens that can come in through the digestive tract, right? We all know that. We've all had, a touch of food poisoning from time to time. So these immune system cells being present in this region help to prevent infection from coming in through the digestive tract. So this would be what we would call a MALT, mucosa-associated lymphoid tissue. And we find these wherever there's a mucosa. All right, what's a mucosa? Anytime there's a region where the outside world is on one side and the body's world is on the other side, there's usually a mucosa there. So like the inside of your mouth, for example, that slippery, smooth covering over the inside of your mouth, that's a mucosa. And that continues all the way through the digestive tract. So anytime you have a mucosa like that, there is usually this MALT tissue, mucosa-associated lymphoid tissue. And there are other examples of lymphoid tissues. This is another one that everybody has seen, and that's the tonsils. So the tonsils are not organs proper, even though, when they're big and nasty and infected, they can look like it, but they're not. They're actually part of the wall of the pharynx. So, they sit, they're technically mucosa-associated lymphoid tissue. So the tonsils are collections of immune system cells lying just underneath the surface of the mucosa of the oropharynx. So everybody's familiar with two of the tonsils, right? The ones that you can see in the mirror when you say, ah. Well, those are the palatine tonsils. So the ones that sit at the back of the throat, just on the left and right of the uvula that hangs down. So those are the palatine tonsils, but there are 4 others. So there are 3 pairs of tonsils. The uppermost pair is called the pharyngeal tonsil, or also called the adenoids, is an old word that people used to use to refer to these. And this is immune system tissue that sits at the back of the nasal cavity. So, the nasal cavity is here, and the pharyngeal tonsil. As we breathe in through our nose, which is the common way we breathe in, right? Most of you are doing that right now. Along with that can come potential pathogens, right? Somebody has sneezed in the room or whatever, and there's virus in the air. Well, as we breathe, the air has to go this way, and then it has to go down. So the pharyngeal tonsil is sort of perfectly placed to monitor the air we're breathing. And one of the things the immune system has to do is identify a problem so that it can attack that problem. So the pharyngeal tonsil sort of monitors the air that's coming in through the nose and down. The palatine tonsils, which we talked about, the ones you can see in the mirror, they monitor as we swallow things. So digestive tract, eating and drinking, as well as breathing through our mouths. Those substances have to pass over the top of those palatine tonsils. So it gives the immune system sort of a first look at what's going in. And then the last pair, you can't see in the mirror, but they sit just at the base of the tongue. So this is the tongue. And behind and down, sort of in the crook between the tongue and the epiglottis here, is the lingual tonsils. So we have pharyngeal, palatine, and lingual. And all 3 sort of are at key spots where infection might enter the body. Yes?
So is that a key spot, like the palatine? How can we remove it then?
Because we have lots more immune system on the other end. So even without tonsils, the immune system is effective enough to deal with any infection. Now, it used to be that if your tonsils were a problem, they just took them out. And what we have found is people who don't have their tonsils actually do get sicker more often. So it's better to keep them if you can, because it reduces the number of infections you get and how long it takes you to fight them off. So they're not superfluous. I mean, it's better to have them than not have them, yeah.
If you do get a wound, do you have to get all of them?
No. Usually they'll just remove the ones that are causing trouble. The palatine tonsils are probably the most commonly removed. I think it's in part because people can see them. If we couldn't see them, we wouldn't worry about them, and if we wouldn't worry about them, we wouldn't take them out. The pharyngeal tonsil is often removed for problems with ear drainage. we have that eustachian tube that drains the middle ear. Unfortunately, evolutionarily, the pharyngeal tonsil sits almost on top of the hole that drains through. So in little kids, like 2, 3, 4, the adenoids can block the drainage of the eustachian tube and create ear infection after ear infection after ear infection. They can also be the cause of snoring, the adenoids, even as much as to sleep apnea, where the airway gets blocked. So every once in a while you'll encounter a child who has terrible snoring. I mean, really, little kids can snore really loud. And it's usually because their pharyngeal tonsils are real big. There's a relationship. As we get older, essentially we have to grow into our tonsils. So the tonsils come up a lot in children because the relative size difference. So essentially, at about age 3, the tonsils are bigger than they should be for the child's size. And that's typically when kids start to have problems with their tonsils or with their adenoids. But the key is you just have to wait, because as the kid gets larger, the tonsils don't. So first the tonsils get big, then the tonsils get small, but they get big before the rest of the child has gotten big. So you end up with sort of a relativity problem. But so the 6 tonsils, and you should definitely know those: pharyngeal, palatine, and lingual.
What do the lingual tonsils monitor?
When we swallow, everything we swallow passes over the top of those. Who asked that question?
I did.
So yeah, this one's primarily GI. So food and drink is what's passing over those. Good question. All right. Okay, so the mucosa-associated lymphoid tissue, the MALT, and the tonsils, those are lymphoid tissues. Now we do have some lymphoid organs. So what's the difference between the tissue and an organ? An organ is separate from its surroundings, and it has a unique and separate task or thing that it accomplishes. So lymphoid tissues are found as part of other organs. Lymphoid organs are separate, right? So usually they have a capsule, so they're separated from the surrounding area, and they have a particular function. So the 3 we talk about are the lymph nodes, the thymus, and the spleen. All right, so first up is the lymph nodes. Lymph nodes are lymph filters. So we saw that, the lymphatic system is this complex vessel system, right? And that lymph begins in the lymphatic capillaries as interstitial fluid enters the capillaries at the tissue level, and then works its way back up either to the right lymphatic duct or the thoracic duct. Well, along the way, there are stops like this called lymph nodes. So here's a lymphatic vessel, here's another, here's another, here's another. So lymph enters the lymph node from the outside, and it exits the lymph node from the middle. So this is a filtration system. Lymph comes in, and then it has to pass by all of these immune system cells. So all of these cells in here are all lymphocytes, and lymphocytes fight off infection. So all the lymph that's passing through the system is going to have to go past all these immune system cells. So essentially it allows this lymph node to act as an infection filter. So let's say that there's a bacteria in the lymph that's coming in here. It's going to get attacked and destroyed before the lymph exits that node. So lymph nodes are supposed to capture infection so that the infection can't spread towards the center of the body where it can cause more and more trouble. So, many of us have had a swollen lymph node or, in our past. Usually it's in the neck. That isn't a problem. That's the lymph nodes doing their job. A swollen lymph node is a lymph node that has captured an infection. And you'd rather have the infection in the lymph node where the infection can't really do much harm except maybe make it swollen and tender, as opposed to having it, say, in the lungs or in the heart, right? So lymph nodes do capture infection sometimes. They do swell up. They do get tender. That's them doing their job. So lymph comes in from the outside, and then lymph nodes have a blood supply as well. So they have an artery and vein that comes in where the lymphatic vessel goes out. And these are macroscopic organs, the lymph nodes are. They're sort of kidney bean sized, and they're sort of kidney bean shaped too. So this is sort of what they look like sitting on top of a muscle here. So we find clusters of these. I'm going to go all the way back to my first slide here. We find clusters of lymph nodes where the arms and legs attach. So like, here's the arm, and then we have a cluster of lymph nodes right here in the axilla or in the armpit. So where the arm attaches to the trunk, we have a whole bunch of lymph nodes. Why? Because what we want to prevent is infection from coming from the extremity into the rest of the body. Because you're much more likely to have like skin injury in your hands and feet or arms and legs than you are in your trunk, right? Because your arms and legs are sort of out there in the world all the time. So we want to make sure that any infection can't get into the trunk where the vital organs are. So we have a cluster of lymph nodes there. We have a cluster of lymph nodes here where the leg attaches to the trunk. And then in the chest, we have a cluster of lymph nodes around the lungs, because we're breathing air in all the time, right? So the lungs are a huge avenue for potential infection, because we're breathing in air from the environment. So to keep infection from spreading to other parts of the body from the lungs, we have this cluster of lymph nodes in the lungs, and then we have another in the GI tract to help guard against infection coming in from from food that we've eaten or water that we've drank. So the lymph nodes cluster in, you can think of them as kind of checkpoints. If you want to protect a building, you might put a checkpoint some distance away from that building. So that's what these clusters of lymph nodes are, is a way to capture infection before it spreads somewhere much worse. All right, tonsils, okay. So lymph nodes. Thymus gland. Okay, so the thymus, very simple, sort of boring-looking gland. It sits in the anterior mediastinum. So we talked about the mediastinum in the last unit, and how that's this barrel-shaped center part of the chest. Well, the thymus sits sort of in front of the great vessels coming off the top of the heart. So this is the thymus gland right here. It is the place where T cells become T cells. So T cells are made in the bone marrow. They migrate to the thymus, and the thymus keeps the T cells sort of separate from the rest of the body. And that separation teaches the T cells what is normal and what isn't normal. Okay, so by the time the T cells sort of graduate from the thymus, I think of the thymus as it's sort of like college for T cells. They go there and they learn how to do their job, and then they go out into the body, and then they're able to be effective. So when the T cells graduate, they leave the thymus, and then they go out and do all the T cell stuff that we're going to talk about in our immune system piece next. All right, so what's interesting is we don't have a thymus our whole lives. Our immune system really develops in childhood. So from birth to 18 to 20 is when most of our immunity develops. So those of you that have kids or know people who have kids, we all sort of know that toddlers get sick a lot, right? They get a lot of runny noses, they get a lot of diarrhea, a lot of vomiting, all those things. Why? Their immune system hasn't had a chance to grow up yet. It doesn't know how to fight all the pathogens that are around us all the time. So in childhood, the thymus is very active and it's very large. In an infant, for example, it can take up almost a quarter of the chest, like a chest X-ray. But once our immune system has learned about the pathogens in our environment, the thymus becomes sort of irrelevant because the immune system already knows how to do that part. So all that to say, the thymus starts to disappear just after puberty, and by 50, it's usually totally absent. So in the adult, you have a hard time finding it, either on X-ray or CT scan or even in a cadaver. So the thymus is not a permanent organ, is the lesson there. It's very simple. The thymus gland is basically just two lobes with a bunch of septa. Septa are just walls. So it's divided into lobules. And inside each of those lobules are tons and tons of T cells. So thymus goes with T cell, and know that the thymus involutes or disappears somewhere after puberty. All right. And then the largest lymphoid organ is the spleen. And the spleen, here it is in a cross section. You know, the liver is on the right. So the whole right upper quadrant of your abdomen is that's your liver, because the liver is huge. It's the largest organ in the body. That's this monster over here. The spleen sits on the left-hand side, so opposite the liver. And it sits in a very protected place because it's sort of tucked up underneath the rib cage in the back. And the reason for that is the spleen is sort of inherently fragile. It has a capsule. It has a very boring anatomy. When you cut it open, it doesn't look like anything. You know, it just looks like a bunch of nondescript tissue. But what the spleen does is it's like a giant lymph node for the blood. So the lymph nodes are filtering the lymph for bacteria, viruses, mutated cells, all that kind of stuff. Well, the blood needs a filter too, because the blood can be an avenue for infection from one area to another. Or, you know, in cancer, for tumor spread from one place to another. Well, the spleen is the filter here. So we have arteries and veins that go in. We have some lymphatic vessels that go in and come out. And essentially, blood has to pass. Blood has to pass by huge numbers of immune cells in the spleen in order to get back out of the spleen. So the spleen is the site for where red blood cells and damaged cells are taken out of the circulation. It's the place where proteins that don't belong are handled. So essentially anything that affects the blood in terms of the immune system, the spleen is going to play a major role there. Now, many have heard, well, you can live without a spleen though, right? And yes, you can, and some people do. One of the most common reasons why a spleen is removed is trauma. So in a car accident, for example, the spleen can get hit so hard that it ruptures, literally kind of explodes, or it breaks open, and the blood starts to enter the abdomen. You can't fix the spleen because its anatomy is so loose and nondescript that you can't sew it back together. So what we do instead is we clamp off the vessels and we take it out. So what does that mean? Well, people used to think it didn't mean anything. But again, just like the tonsils, we've learned that people who don't have a spleen are at a much higher risk for blood-borne infection. So anybody nowadays who doesn't have a spleen, like when they have surgery or when they have dental work done, they'll take antibiotics beforehand because they don't have a spleen to fight off bacteria traveling through the bloodstream trying to make infection. So it is not necessary for life, but it's better if you have one than if you don't, yes.
Why is the spleen always really large when, say, you have mono or you have appendicitis?
It's the same thing. It's working on fighting off the infection in your blood. So like mono causes an immune response that makes the spleen swell up. And it's one of the reasons why, like if you play sports and you have mono, you can't play, for like 3 months or 6 months or whatever, is this, you have to wait for the spleen to go back down to its normal size. Because an enlarged spleen is even more fragile. So, you get hit on the soccer field and have mono and your spleen ruptures and they have to take it out. And now you've got to take antibiotics every time something bad happens to you. So, the spleen, a underrepresented or underappreciated organ. All right. Okay. All right, let's do some questions and then we'll call it a day, I think. All right, compared to blood capillaries, lymph capillaries exhibit all the following except. So it's one of those except questions. Let other people on?
No,
Huh?
It says it's waiting for you.
Well, it is not waiting for me. All right, let's try it again. Any change? We'll get there. Hold on. I've been having Wi-Fi trouble.
Here we go.
That was it. Wi-Fi not connected. I got 6 people in the room with 5 answers. Anybody not playing?
Mine's not coming up.
Oh, okay. All right, so which of these is not the case? All right, basement membrane. I know we didn't talk about that, but they both have a basement membrane. Blood capillaries the lymphatic capillaries are the larger of the two. The lymphatic capillaries have irregular shape, and the blood capillaries are the smaller in diameter. So, yes, it would be D, because they're not smaller, they're larger. All right. Most of the lymph returns to the venous circulation by way of which of those? That's everybody, okay. So B, thoracic duct, which most of you put A. So we have 1/4, 3/4, right? Quarter of the body, right lymphatic duct. That's right side of the head, right arm, right upper chest and back. The rest of the body, the 3/4, goes in through the left side, and that's the thoracic duct. So make a note on that, star that one slide, because I didn't ask you to know very much about the vessel system, the lymphatic vessels, but I do want you to know about the capillaries and where they end up, which is the right lymphatic and the thoracic duct. All right. Last one. Which of these statements about lymph flow in the capillaries is false? Afferent means to go into, efferent means to go out of. You should remember those words from last semester. All right, so if efferent is to go out of, what exits the hilum is that center part where the arteries and veins come in. So the lymph leaves the lymph node at the hilum. So that's the efferent, which means that E can't be true, because the afferent lymphatics come in from the sides and the efferent comes out the center at the hilum. All right, that's it, everybody. Thank you. Next time, we'll get into the immune system.